What are concussion signs in infants and toddlers? Imagine a tiny head bumping into something or a sudden jolt that shakes a little body. Concussions are mild brain injuries that can happen after a bump, blow, or jolt to the head or body. Recognizing these injuries in infants and toddlers can be tricky because they cannot tell us how they feel. Instead, parents and caregivers need to watch carefully for changes in behavior, mood, and physical abilities that might signal a concussion. A concussion temporarily changes how the brain works but usually does not show up on scans like CORT or MRI. Most children recover fully with proper care, but quick recognition and medical attention are key to keeping them safe and helping them heal. In infants, signs are mostly behavioral and physical. You might notice your baby sleeping much more or less than usual or having trouble waking up. Changes in eating habits are common, like losing interest in feeding or refusing to eat. If your baby is fussier than usual, crying excessively, or cannot be comforted even when held, these could be signs. You may see decreased alertness or responsiveness, such as the baby seeming dazed, less interactive, or not responding normally to sounds, lights, or touch. Vomiting, especially if it happens more than once, is another warning sign. Watch for any changes in movement, like trouble crawling or sitting up, or if you notice a bump or bruise on the head. Remember, a bump alone does not confirm a concussion, but it is important to be alert to other signs. As children grow into toddlers, they can show some of the same signs but might also display new symptoms because they are better at expressing themselves. Toddlers might become more irritable, have mood swings, or have unexplained emotional outbursts. Changes in sleep patterns, such as sleeping more or less or having trouble falling asleep, are common. You might notice they lose interest in favorite toys or activities, or they become clumsy, unsteady when walking, or have balance problems. Persistent crying that cannot be soothed, refusal to eat or nurse, vomiting, or nausea are also signs. A toddler might seem dazed or confused, less alert, or less responsive than usual. Sometimes symptoms do not appear immediately after an injury. They can develop over hours or even days. It is very important to keep a close watch for at least 24 to 48 hours after a head bump. Symptoms like worsening headaches, more vomiting, confusion that lasts, seizures, or new signs should prompt immediate medical care. If your child loses consciousness even briefly, has repeated vomiting, shows signs of seizures, cannot be awakened, or has a worsening headache, seek emergency help right away. Prevention plays a big role in keeping little ones safe. Always use car seats suited for your child's age and size, secure furniture to prevent tipping, and use safety gates to block stairs. Supervise playtime carefully to avoid falls. If your child hits their head, stay calm and comfort them while watching for symptoms. Do not give any medications unless your healthcare provider advises it. Keep your child from rough play or activities that could cause another head injury until a doctor clears them. Every child is different, so if you are unsure whether your infant or toddler has a concussion, it is best to consult your healthcare provider. Early recognition and proper management help ensure the best outcome for your child's health and development. Remember, trusting medical professionals and following their advice is the safest way to care for your little one's brain health.